Well, in tonight's Women's Doctor, do you think you need joint replacement surgery? If you've been putting it off, you may want to reconsider. Orthopedic surgeon Dr. Joseph Ciotola at Mercy Medical Center says if it's really affecting your normal daily life and you've exhausted all the non-surgical options, it may be time. Waiting too long can cause bigger problems like becoming stiff. With women, knee replacements are most common, and then the hip and then shoulder. And he warns, watch out for regenerative medicine.
There is no real regenerative medicine. If there was, we would be doing it, right? So there are therapies like platelet-rich plasma that do seem to help with patients' pain that are having joint replacements, and I've used that, I've used the fat, I've used the bone marrow. These things have anti-inflammatory proteins in them that make the patients feel better, but they're cash only.
Well, Dr. Ciotola says joint replacement technology has come a long way, and the plastic basically lasts forever because it's so strong.